I know that Matheou has sent out a note inviting me to talk a little bit about how we are working in East Africa and how we've adopted some new strategies to try and increase the focus and the relevance of our work. And I will talk a little bit about that, but to get to it, I want to take you through some of the thinking that we have been through in East Africa that has led us to believe that we do need to do things a little bit differently. And I want to tell you a little bit first about, just a few words about the humanitarian drivers that are shaping our context. To say a little bit about the scrutiny that the humanitarian sector, and us particularly, have been under in East Africa. Then say a little bit about the donor climate, which we just need to understand if we understand what is possible and not possible for our work. And then I'll get to where that's taken us in terms of our thinking and what national societies are saying to us about what support really would be relevant for the years to come. Well, in terms of the humanitarian drivers, I think probably what we would say for East Africa is really quite consistent with what we would say for the rest of the world. I mean, we're looking at certain key concepts of climate change, population growth, urbanization, and conflict. And like in other parts of the world, we're anticipating that that will mean that there will be an increasing number of small, medium, and large-scale natural disasters affecting increasing numbers of people. We are expecting that there will be increasing numbers of people moving into urban areas, many of into slum areas, and the vulnerability that is enhanced by that. And because there are increasing numbers of people, increasing conflict for land and resources. That issue of climate change, its impact on natural disasters, and the numbers of people it will affect, plus the impact of urbanization, is likely to be setting the humanitarian context in East Africa for the years to come, just like it is in the rest of the world. But the lesson that really comes from that is that we would expect the demand for humanitarian organizations and for humanitarian services to increase in the years to come and not to decrease. But while that may lead us to automatically think we need to be doing more, there are certain things that we need to understand that should guide what we do and the opportunities that we have. And two of those key ideas around the scrutiny that the sector is under in East Africa and the donor climate. And I want us to say a few words about both of those. There is certain scrutiny that the humanitarian sector is under in our region that is also quite common for the rest of the world. And you'll be familiar with them from the number of books that are being published and the newspaper articles. Basically, they can be summarized that, does humanitarian aid actually work? Does it sometimes do more harm than good by being complicit with government programs that are perhaps not humanitarian in their intention? Are organizations primarily interested in occupying their market share and protecting their structures more than they're interested in actually helping vulnerable people? Are interventions really locally owned and sustainable, or are they artificially manufactured externally and imposed on countries? And are organizations doing enough to really be efficient and cooperate together when it's necessary for scale up and impact? Now, those criticisms that we are dealing with when we're working with the external donors and with governments are true for the Federation just as they're true for any other humanitarian organization, probably not just in East Africa. They're just things that we are wrestling with as a sector. But then there's the criticism that or the scrutiny that we are under as an international federation trying to promote the work of the Red Cross movement in East Africa. And that scrutiny is something we need to individually understand and deal with. And I have not got a PowerPoint presentation, but I'm going to put this one slide on now, if I may. If you just press blank, it should come on. What I did, just as while this slide is coming on, when I joined, I spoke to all of the East African national societies. I spoke to external donors, and I spoke to all the PNS. And basically, I simply asked the question, what is going well? What is going less well? What has encouraged you to partner with the International Federation? What has not encouraged you or acted as a deterrent to partnering with us? And I just want to highlight some of these because we need to understand them. I'll just mention 4 of them, although There's a bigger list than this, and there is a bigger list of positive things as well. I've just not included it here. The key ones, the accusation that the organisation has done a lot of internal restructuring over a number of years, and this has meant that it's perhaps thought more of itself than the people that it's serving, and that this has not made us a steady partner to many of our key stakeholders over the last 4 or 5 years. And just a really key message that stability has got to be something, a strategy that we adopt in the years to come. This issue of being spread too thin, very, very crucial. I'm going to come back to it in a few moments when I talk about the donor climate. But basically, the accusation is that if you try to do a little bit of sexual and reproductive health, a little bit of food safety, a little bit of HIV, a little bit of TB, a little bit of malaria, a little bit of disaster risk reduction, a little bit of food security, etc., you're going to end up with a portfolio so small in its scale and diverse that you are never really going to be positioned clearly anywhere in the humanitarian world. And this is an accusation that has come to us from all of the people that I spoke to. Third one that I'll just highlight now, reporting is too weak. This really came from the PNS and the external partners. But basically the point is one that we need to understand, that many of our colleagues in the wider sector are moving much more towards understanding from evidence-based what's working and not working, collecting data on outcomes and impact. And we are, to be frank, still reporting on activities. And this, within the humanitarian sector, just does not put us high up on the credibility scale when it comes to dealing with external partners. And the last point there, that we've learned to live without you, it's a real challenge, because basically both the East African National Societies and the PNS, and to some extent even external donors, refer to the fact that we've begun to move on from this idea of having this intermediary role between us and the East African National Societies, and we're not quite sure that you have a clearly defined added value at the moment. Now, I'll come back to that, but we just need to be, I think, alert to that challenge about redeliberating our added value with our key stakeholders. So there's that environment of scrutiny that's partly about the humanitarian sector as a whole, and partly about our need for stability, our need for focus, our need for increasing addressing quality issues, and the need to re-articulate our added value that is there shaping our environment in East Africa. We can put the slide off for the moment. No, let's put the slide off for the moment. Then there is the next thing that is really shaping our reality, and that is the donor environment in which we work. And again, here there's a combination of what's happening for the whole humanitarian sector and what's happening specifically for us, both of which we need to appreciate as we're moving forward. If we take the issues that are shaping the humanitarian sector as a whole, and in East Africa is no exception, but these are the impact of the financial crisis and the general sense that we are going to see less money given to less partners in the coming years. This increasing demand from donors to look at, to partner with those organizations that are focusing on demonstrating the evidence of impact. The whole influence of the private sector coming from foundations like the Gates Foundation and the Global Fund to really insist on efficiency as a concept that the humanitarian organizations work with. That is, that they want to see a certain amount of output for the input that they give, and for that to be understood and analyzed. Plus, the number of donors and who are the donors has changed. I read that 10 years ago there were just 12 government donors in the world, and now there are 112. There's a whole range of sort of diplomatic relations that we need to cultivate when it comes to funding humanitarian work, which we're only beginning to do. So there are, and perhaps I would add on top of that, the whole sort of dynamic among the traditional donors about good donorship and the commitments they have made to give more quality money in terms of for relevant interventions in a timely manner with realistic reporting requirements. So there's that donor environment that we're existing within in East Africa, and then there is our own specific funding environment, which is probably the biggest bottleneck that we deal with when it comes to working in East Africa. And I think we just need to understand it in this house, because we are frankly all part of it. Now, I need you to jump back about 4 slides. Just back. Well, back on. Okay, stop there. That'll be do. Okay, we don't need to analyse this in any detail, but I want to just show you 3 slides very quickly. I mean, if you glance at that, which is our funding base for the regional appeals in East Africa. Now, you may be thinking, well, that looks quite healthy, a diverse funding base. Actually, it's not as good as it might look. What you've got there are 2 or 3 consistent investors in work in East Africa and lots of little grants given for 6 months, 8 months, 12 months, 18 months for one little intervention. If you go to the next one, which is the funding for the national societies, not the regional appeal, it's quite a similar story, relatively diverse, 2 or 3 really sticking out, and others just dropping pieces of money in for 1 year or 2 years. Now, the key point here, the next slide, that looks much less impressive, is actually the only money that has ever been raised in East Africa for the last 3 years. The point that we need to understand here is that the International Federation in many parts of the world, and Africa is not an exception, as we can see, is actually not generating money itself. It is a recipient of money that is generated elsewhere. Now, if you are a recipient of little grants generated elsewhere, you are not going to be in charge of your strategy. You are going to be very, very reactive. You are going to be running around implementing initiatives for short time frames of other people's agendas. And understanding that traditionally the organisation has been a recipient rather than a generator of funds is quite important to understand the key issue that we're going to have to address. And if that can go off now. And if that's true for us, it is doubly true for the national societies. One of the Secretary General said recently at a partnership meeting that he said it to 4 or 5 donors sitting in front of him, that if you stopped funding my organisation, within 4 months we would have no services left for anybody across the country that I'm responsible for. The same donor base for the last 20, 30 years, still very much dominating the agenda. Another Secretary General said to me that I've got 20,000 volunteers across the entire country, trained in a whole variety of issues around infectious disease control, health, sanitation, disaster response, risk reduction. All I really need is a light, decentralized structure that would allow me to keep those volunteers within those communities, keeping those communities more resilient. But I am constantly turned around to face 4 or 5 donors giving me vertical projects, forcing my entire system to respond to the project management of those small, time-limited interventions. The consequence of that is you have an organisation, again, not entirely in charge, something not entirely, perhaps very little in charge of its own real strategy, in the sense that it is forced into a reactive mode away from its core services or its core costs, which I'll come back to. So on that donor issue, I just wanted to make those points, that there's the changing donor environment in which we work, and there's the specific donor environment in which we operate, which keeps us quite fragmented and spread really quite thin. And it has kept national societies for many years really dependent on a limited funding base which is still project rather than core function based. And we need to understand that to understand what sort of the ways to move forward. If it comes to where we're going, I mean, there are key messages coming to us in the sector, and there is what we do with that in East Africa. Key messages that we're probably all aware of coming out of the analysis about donor trends and the humanitarian context. 1, don't wait for the disasters to happen. Invest in community resilience and disaster risk reduction now, and keep the communities as prepared as possible for the inevitable increase in natural disasters. 2, if you are going to respond to natural disasters, concentrate on protecting livelihoods rather than just giving relief. 3, ensure as much as possible that your interventions are really community-owned and thereby sustainable and not externally generated and imposed. 4, invest in collecting evidence, because that's what's going to distinguish the organisations that are working well and not working, and will demonstrate you as an organisation who is a credible partner. And 5, be a good donor that promotes those above 4 points, essentially. Now, that sort of summary which is coming down to all organisations, probably ourselves included, really quite nicely summarises where we're going in, excuse me, in East Africa. Now, some of you will have received the concept note which we sent out, which I'm not going to go into detail now. But essentially, what we have done is really something quite simple. We have taken that challenge posed to us by national societies about how they see their services. We've looked at it from the perspective of a branch. You are a branch chairperson with 1 or 2 professional people or paid staff next to you, and maybe 300 or 400 volunteers in your community. You are facing challenges around water and sanitation, around potential epidemic threats, around risks of natural disaster, around food security issues in some cases. Your volunteers are dealing with all of those threats, but the funding is coming in in a very vertical, single issue manner. All we are suggesting is that our strategy respects that multi-hazard approach, that we recognise that those volunteers within those communities are looking at preparing for all sorts of risks, health, food security, natural disaster, are getting trained in mitigating those risks, and need to have surge capacity to respond to them if the crisis escalates. And that we bring basically all of our technical support teams into one department around that community resilience agenda. And we focus on working with stakeholders, on positioning national societies as the lead organisation able to do community resilience work to scale. And that we partner with them on the innovations necessary to keep that work up to date around early warning systems, for example, and some of these initiatives being led here as well about the use of cash and livelihood protection. It's really quite simple, and by all means do look at the concept note to see that in more detail about what it means in practice. That, when discussed with national societies, goes down very well, because it can address all sorts of issues about making appeals more relevant, humanitarian diplomacy more relevant. It makes us more focused and keeps the funding more focused. But if I were to end there, it would not tell the whole story. Because after the discussions that was presented to national societies as, okay, this is what you've said, this is what the humanitarian world is saying, this is what you're saying, this is where we can go together. Their response was, great, you have now covered about 10% of the things that interest me. And are we going to talk about the rest? And of course, it was a reminder to me about the tunnel vision that even with an integrated approach, we tend to have when it comes to partnering with national societies, because as professional humanitarians, the things that interest us are what's having an impact on people's lives, what are the size of the operations, how do you manage them, what are the good practices we can include, etc. That's what we're interested in and what we're about. What the Secretary General said was, well, actually, at the moment, I'm dealing with a lot of pressure from my government to do things that I don't particularly want to do. I'm having trouble with my governing board. I've got a problem with one particular branch that I've got a corruption case that I need to deal with. There's the issue about how to keep the volunteers active in those branches where there are no funded programs. There's a leaking pipe. There's a PNS that's causing me trouble. There's a whole world, basically, of what it means to be a functioning national society that stays afloat in difficult contexts. And that is about a lot more than humanitarian operations and programming. It's about management, leadership, survival, politics, diplomacy, etc. And what they said was, when it comes to learning, what we would like is a platform where those issues can really be discussed with people who have lived through them, CEOs, ex-CEOs, ex-successful SGs, but really that's where we're at as national societies, no longer needing to be taught, just needing to be in an environment where peer support is encouraged and supported. And that is one of the challenges they posed. Can you provide a platform where learning peer support about what it means to be a successful national society is possible? And the second challenge was perhaps even more profound, but even more difficult. And it comes back to this issue, which is why I raised it before, about the way that the organisation is funded. Basically, these national societies are really, really very good. And it's probably a credit to many of the people who have been in this room or have been in this room before or have been in Nairobi before. Mostly their own credit, I'm sure, but lots of people have played a role. But they're really, really very good. And what they want to be is the first responder to every disaster that takes place within their countries. First one in, last one out, and looking at those hazards from a multi-risk perspective, able to engage in the health threats, the food security threats, the natural disaster threats, and the livelihood protection approaches. That's what they're interested in. But to do that, 12, 13 vertical projects along different areas is not going to allow them to do it. One said, all I would need is about 2.5 million Swiss francs a year just to maintain my small, light structure and to keep my volunteer base trained and engaged in these community resilience issues. But they can't get their hands on that type of support. And so the challenge that was posed back was, is it time now to engage with people like the World Bank or the African Development Bank to really recognize that investing well within 2 or 3 years, the contribution these organizations can make to poverty reduction, to disaster risk reduction, really could be quite profound if they were given that freedom to play that core mandated role. And that is another challenge that was posed. So those are 3 things that we have to think about. 1 is this relevance of humanitarian operations and the positioning and the good practice. 2 is that platform for shared learning between organizations who are at really quite sophisticated levels of development. 3 is this whole issue about how do you change the funding base so that it allows for core business to be practiced. And I think it's possible. I mean, I know since I joined, a few people have said, oh, well, East Africa, it must be very difficult. But actually, all the ingredients for success are there. You've got strong national societies. You've got some really good PNS who want to engage. You've got a humanitarian community that's funding humanitarian work. You've got big humanitarian needs and reasons to engage. It's just a matter of getting that recipe right and then making it happen, which hopefully we can. It will take another 2 months before a core team is up and running, probably another few months after that to be inducted. We are revising the 2011 appeal along the community resilience agenda, which will be ready in February. So we'll have a marketing tool that we can start using. We are also, together with colleagues here, looking at 2 key framework documents that will be positioning tools. One is about drylands and how national societies can play a role in dry regions and regions threatened by drought, and 2, how they can do the same in wetlands in regions threatened by flood. Those will be ready mid next year, probably. So it's basically going to be an ongoing process. I don't think there's a day when we say it's now happening. It's ongoing. We're already working with the PNS around the table about the small things we can do now to bring things in line. Consistent use of terminology, consistent use of indicators. These are small things that we can do that start preparing a consistent approach towards work in East Africa. I would say within 12 months, we will be proud and excited about what we're doing. 2 years, we will reach our ambition to be at least 50% non-PNS funded with a much more autonomous ability to support national societies to diversify their funding base along these lines of good practice. It all depends on the grant. I mean, I think there's, as I said, there's not a lot that's being proposed that is fundamentally different. It's about how we recognize that it is integrated and needs to be managed in an integrated way. The branch see it as integrated. It's the donor and the manager that often doesn't. So as long as it's compatible with that agenda about making communities more resilient, I'm sure it can be integrated. I would say this to people here that, the strong message, I suppose, is if we're going to work together on any type of investment into programs, let's do it seriously, to scale, good quality, and for a number of years. If you've won a global grant and you're sort of scattering it around the world in little bits because it looks good on a map, and I don't insulting anybody here, but I understand the temptation because I've done it myself. Just remember that a global program can often end up as a cabbage patch in a village somewhere, and that's all. Unless you think about really investing for years. It may look good from a distance, but in reality, it trickles down to be something very, very small. So more depth, more length of time, perhaps less geographical coverage or more thought through geographical coverage. The little the little short projects sometimes do more harm than good, at least to our ability to sort of position ourselves and move forward. Well, the basic principle that we're looking at the moment is it's the same volunteers doing the disaster risk reduction programs, the health programs, and the WhatsApp programs. It's only the management that is vertical. So it's simply respecting that what you're going to look at within a community is a number of risks, of which some will be more pertinent at any one time. And it's about a volunteer-based, able to deal with them as they occur. And that's really, you know, a simple answer, that we're only saying that the basic training skills of the volunteers that we're working with should be able to look at both the health, risk reduction, sanitation issues that they are facing. Well, I mean, the suggestion was that it goes together with the evidence base about what's working and not working. I would argue that a national society that is trained to be a first responder to all natural disasters and is always there first and is looking at it from a health risk, food security risk, livelihood protection risk, is not adding value. It's doing its core business. It may not be implementing a nationwide HIV program or a nationwide TB program, but that core business about being the first one in, looking at immediate protection in times of natural disasters and being prepared to do that, I think is a value added. But that doesn't mean I disagree with you, because there are some specific interventions, such as, for example, looking at HIV or looking at TB, where specific skills need to be adopted and implemented to scale. And if you're not around the table with the Global Fund, and if you're not in line with the government's programs, you're probably going to be playing a slight role. And we know that's what's happened with HIV and TB. I don't think anything that's being suggested here today is that we are now, I mean, it's only what we're saying we're doing as a federation, not what national societies are doing. It's not saying that they wouldn't engage with the Global Fund on HIV or TB. It's simply suggesting that we take a step back and recognise there's core business, which is much more holistic than the way that we've managed programs, and that is the foundation with which we do our diplomacy, our fundraising, and our positioning. And when emergencies arise, such as an HIV epidemic, then some type of skill adaptation or role adaptation would be appropriate. The ICRCs have been around the table at all the partnership meetings. They're very, very keen to make coordination work. They're dealing with national societies that are really quite strong. With the Kenya Red Cross, there's a useful strategic partnership, I think. I mean, the Kenya Red Cross, I think, is strong enough to identify the aspects of partnership that are of value to it. There's one thing with the ICRC that's about, they like the idea of a livestock ERU. And there's the ICRC is really quite strong on livestock protection. And so they have formed a strategic partnership on that area, which is going well. In other parts of East Africa, the ICRC have traditionally had a dominant role in times of conflict. Rwanda, they're really, really cutting back now. Burundi as well, Uganda as well. So for the most part, the ICRC is reducing in size, not increasing in size in East Africa. I mean, this is one of the big challenges that we face. There is a very active active PNS community in East Africa. There are, I think, 11 or 12 sitting in the building that we sit in, with their own representations. They are mixed. There are some that are very sort of supportive of engaging on a multilateral approach, some of which are very, very bilateral. I mean, our suggestion is that at the moment it is too fragmented to be effective, and that what you've got is essentially a small community of NGOs running small pieces of work. And that is very bad, actually, for the Red Cross movement and how it's perceived and the scale with which it works. There's no way we can force people around the table. What our approach is to offer something that is genuinely valuable. That is a vision that makes sense, that is based on the National Society strategies, and that has an agenda that's about quality and scale-up that they will want to get behind. And as I said, we start with the small things, just some shared terminology. So when we're introducing ourselves, when we're talking about what we're focusing on, we are using the same consistent strategic terminology. Then we're moving on to shared indicators, so we can start reporting on the same things and talk about what's happening to scale. We're forming technical working groups with the PNS. We have monthly PNS meetings where we just discuss collectively what we're doing and where we're going. We're not there yet where we should be, but I would say that we've got good people around the table trying to make it work now. And the Horn of Africa review was a good example. I think some of you would have seen it. There were many big appeals towards the Horn of Africa between 2008 and 2010. The review that was conducted about what worked and what didn't work was the result of several PNS getting around the table and saying together with us that we need to get better at this. And that therefore that ownership of the review gives us shared ownership of the findings about how we will look at response to drought in the future. So I'm sure if there was a magic recipe to success, we'd have found it 90 years ago, or at least more, we'd have found it by now. There's not. There's only diplomacy, and I think just understanding that the essence of every partnership is reciprocity. When we have something to offer of value, we will get engagement. If we step back and don't, it will lead to drift. Not yet. I mean, I think that we as I mentioned earlier, we are at a sort of bottleneck where the national societies are not yet as a whole independently cultivating relations with donors and independently writing applications. There is one exception. Well, there are a couple of exceptions, but the main exception is the Kenya Red Cross. But even there, actually, there's still quite a tradition of the intermediary PNS standing between their government donor and the recipient national society. Two of those government donors did say to me recently that they envisage within 2 to 3 years bilateral relations with the national societies. So it's there potentially on the horizon. But this issue about a sort of a Red Cross umbrella still sheltering national societies from the external world of donors is very much there. And I think taking down that umbrella and encouraging those bilateral relations to flourish is entirely appropriate over the coming years. How it will be perceived by some of the national societies in Europe, I'm not sure, but it's potentially possible now. That's a good question. I mean, on the first one, on the terminology, I suppose I'm just still trapped. I'm just still using old-fashioned terms. I mean, I think we all understand that we have a broader agenda that involves development activities, actually. I just don't think many of us have got used to referring to ourselves in that way. And I think that in some ways it's not something that bothers the national societies very much. They do what they do. And sometimes the word wars take place and definitions take place elsewhere. I would accept that we definitely have a broad agenda that involves development activities, myself, and I think most national societies would agree. On the issue of are we strong enough to turn down money, I would very much like to think that we would. I like to think that personally I would if it was coming to me. I think that there are some national societies in the region who also would. But I think it's going to take addressing that challenge about lots of small pots of money and national societies feeling confident that there's an income stream they can rely on consistently for core work before that really happens. Because right now the sad truth is that paying the electricity bills can really bother a Secretary General, even though he should be thinking about lots of other things. But because the funding is so earmarked, that core structure and core business is really a constant struggle. So I think at the moment there is an opportunistic approach to fundraising, as in taking what's given. I think we should work away from it. Well, there's been no assessment or criteria since I joined, for sure. My description of them as strong is based on the fact that they have, over the last 2 or 3 years, successfully mobilized a lot of volunteers and responded quickly to natural disasters in a way that is generally considered credible by the community within which they work, and I mean that the humanitarian community as well as the local community. It's probably not deeper than that. The fact that what they're saying when they present their strategy is coherent and relevant. They are seeking resources beyond the traditional donors, or that's not been very successful yet, but they're very, very aware that that bottleneck needs to be broken. They have strong bilateral relations with a number of partners. They're respected, as I say, by stakeholders in the humanitarian community. It's probably just those impressions, actually, that are guiding me to say that. I've got no reason to believe they're fundamentally wrong. Nobody would suggest that it's all perfect or that there are not issues. I would just suggest they're credible humanitarian organizations with normal management challenges. Yeah, so, and I probably couldn't go into any more detail than that. So, I think that the key is to be able to see things from the perspective of the National Society themselves, especially at a branch level. I think that they, especially at the level of development that they are, and their self-awareness and their confidence, there's actually very little room to be influencing something fundamentally new, only to be a partner along a journey that's being articulated themselves. And you know, this whole issue about the stages in which an integrated approach will be functional or not, I don't have the answer, so let's just keep discussing it. So, yeah, please. Well, I think some of them are moving in that direction. I think there are some, as we talked about yesterday, some national societies have diversified their funding base, particularly, as I said, the Kenya Red Cross. I think it's absolutely profound question you're asking, and I'm not sure that we fully know the answer. I have posed the question. I mean, I would hypothesize that some of the issues are that it's not an organization that has ever had to survive out there in the humanitarian market. It's always been cushioned by external support, by people who want to give money at least as much as they want to receive it, because it's vital for their own survival. And that sort of very artificial donor climate for decades has not created the sort of vibrant leadership that, at least marketing, that other organizations without that protection have to survive. I mean, I know we both agree missing the Global Fund was a huge opportunity where the Red Cross societies across the world should have benefited from that unique opportunity to work to scale on infectious disease control. Why didn't it happen? Why were those efforts not made? I can only speculate that one of the reasons is about the fact that that fighting for funding outside of the Red Cross movement is not something that's ever really happened, and therefore perhaps it's not surprising that it's not happening now. How to make, how to sort of take that umbrella down and make people more marketable, I think, that's a journey we have to take. And I don't know the answer. I think, we can articulate the problem. Well, I mean, I would just say that one of the key messages that the Secretary Generals have given is that, yes, that is a way that the Federation can add value in the years to come. This whole dialogue around diversifying the funding base so that it involves non-Red Cross donors as well. And so the offer is there, the platform is there for the dialogue, and that's a journey we have to take together. I agree. It's a key point. Well, I mean, they're two quite different things, RCNet and NEPARC, and the question is how effective are the networks at promoting learning within East Africa and within the continent? NEPARC, I think, is a very good idea. I don't know whether you would agree. The basic idea that peer pressure and peer support is now an appropriate way for learning to take place, and that organizational development interventions, if there's not fertile ground or willingness on behalf of the leadership, are not going to work, and therefore NEPARC is sort of pacing itself to work with the willing. And I think that idea is quite good. Has it actually led to positive changes yet? I've been given some examples of when it has. We'll have to see how it grows in the years to come. RCNet is a bit more of an artificial structure because it's been funded by the Federation over the years. Now we are not, and we'll have to see whether they're willing to invest themselves in that platform for peer exchange. So, I mean, the both concepts that there's less room for training and more room for learning amongst each other. That's well understood. I'm not really sure if those two, I'll have to see whether those two networks really perform that role. And as for the capacity building around resilience, that will be part of the programs and the work that we're engaged in around drought cycle management. I would like to work with NEPARC, ideally. Whether that's going to work or not, we'll have to see, but I have good discussions with them. The ideas, I think, are very good. It's just really whether that relationship can function and it can perform that service, and if the national societies accept it. But I know there are some national societies who feel that is the appropriate medium, and there is one national society in the region, and if it's not NEPARC, it's hard to imagine how the issue could be tackled, because it could only be tackled with the credibility of peer pressure, not with somebody external coming in. Is there any more? I know that probably some of you got meetings at 2 o'clock, and it's exactly 2 o'clock now. So I just wanted to say thank you very, very much for coming. It was a pleasure to have this chance to talk with you. And I look forward to working with you all. Because we need friends and partners, so thank you.